What's up guys, Victor from Cyborg for Life, and today we're going to talk about the device removal process. That's right, after you get your desired limb lengthening for either height or fixing a discrepancy, you got to get them bad boys out of your bones, or at least you should. We're going to focus on the internal nail removal, as external fixators are relatively the same and perhaps a little less involved depending on how you look at it. And so we're going to focus on the why, when, and how nails are removed, as well as the post-op care and expected recovery. Also, I want to give a huge shout out to patient S, the quadrilateral stature lengthening patient I met a few weeks ago in Baltimore who actually had his nails removed and gave a lot of insight and advice for this video. All right, so why should you get your rods removed? Well, a few reasons. First of all, if you're lengthening with a magnetic nail, they contain rare earth metals that are hermetically sealed. However, over time, we don't know if they're gonna stay sealed or if they're gonna leach out and have unknown consequences within the body, which is not a risk that you and or the surgeon should take. But what about if you have a mechanical nail that has no external distracting mechanism like electric motors or magnets? Should you still get your nails removed? And the answer is yes. And that's because of the rigidity that the rods and screws cause within the bones, which naturally have some flex to them. Me, patient S, and other patients that I've spoken to all agree that bones are lighter and have a more organic feel after removal. So if you want to feel as normal as possible, get your nails out when it's time. And don't worry, you're still going to be Cyborg for Life in my eyes. Now, when should you plan to have them removed? Well, that actually depends on when your bones are consolidated enough with enough cortical bone to handle full weight bearing without assistance. For most patients, that's usually around the 1-year mark. So how does nail removal work? First, you need to decide on a surgeon who's going to actually do the removal. And it doesn't have to be the same surgeon who did the initial surgery. However, most patients will find themselves gravitating back to familiar grounds. But the word on the street is that if you pick a limb lengthening surgeon who accepts your insurance, you could potentially have most, if not all, of the removal surgery covered, minus things like food, travel, and accommodations. In fact, that's what patient S did. So yeah, you're welcome. While the initial surgery takes place at the hospital, where you're usually discharged after about 2 days or so, the removal is an outpatient procedure that can be done at an equipped off-site medical clinic via general anesthesia, and typically takes about 2 hours or so for a bilateral limb segment, meaning either both femurs or tibias. So the surgeon's gonna do their best to remove the hardware through the same original incision sites to prevent additional scarring, but this is going to vary. Regardless, the incisions are still very small for internal nails and they often heal very nicely. After removal, the incision sites are bandaged up and it's your job to keep them clean and dry for up to 5 to 7 days after so that the wounds can heal closed and you'll be good to go. Once discharged within a few hours after removal, you should take it easy. Most patients will experience some sort of pain, swelling, and inflammation, and this is going to typically resolve within a few days. You can also manage it with pain meds. Now, I personally avoided things like NSAIDs and anti-inflammatories because I was fearful of decreased bone healing because of the reduction in prostaglandin formation via the COX-2 mechanism, but there's not enough evidence to technically prove this, and that's neither here nor there, so I digress. Now, patient S told me that although you can technically walk after removal, you should use some sort of walking assistance for a few days for stability because you're likely to be sore and stiff. Also, try to use ice and compression and elevation for the swelling that you're likely to have, especially in the tibias. As far as where you can expect to feel pain, soreness, and discomfort, S mentioned that for tibia nail removal, the knee or the patellar tendon will be the main site and some irritation around the screw removal sites. And if you're getting the femur nails removed, the upper outer hip is going to be very sore. He recommended if you're traveling for removal, you should stay local for a few days to rest before you go back home. After about a week, most patients can return to low impact activity, but you should avoid things like running, jumping, and agility movements for about 6 weeks to avoid fractures from the screw holes, which yes, will fold back in and harden nicely if you're the compliant patient that I know you can be. And as far as what you can expect in terms of recovery, according to S, me, and other patients, before rod removal, the leg will feel heavier and more rigid, but after you get the hardware out, your leg feels lighter and more fluid. And this is why I often say you won't be 100% until you get your nails removed. All right, guys, that's all I have for you today. I hope you enjoyed the video about nail removal. If you have any comments or questions, put them down below. If you did enjoy the video, go ahead and hit that like button. Be sure to subscribe. Until next time, this is Victor from Cyborg for Life, signing out.